Muscular dystrophy, how to assess pain in nonverbal patients. Imagine trying to understand how someone feels when they cannot speak or tell you directly. That's the challenge faced when caring for nonverbal patients with muscular dystrophy who may be experiencing pain. Since these patients often have difficulty communicating their discomfort, healthcare providers relying on careful observation and systematic assessment to identify pain early and manage it effectively. The first key indicator to watch for is facial expressions. Pain can cause noticeable changes in the face. Look for rapid blinking, furrowed brows, clenched teeth, or narrowed eyes. Sometimes, the patient might raise their upper lip or wrinkle their nose, which are subtle signs of distress. These facial cues are often among the earliest signs of pain and can give important clues about its presence and severity. Vocalizations are another important sign. Even if a patient cannot speak, they might cry, moan, sigh, or scream. Changes in usual sounds or increased vocal effort can signal discomfort. Listening carefully to any new or unusual sounds during movement or care activities can help identify pain episodes. Body movements and posture also reveal a lot. Patients might guard or rub a specific area that hurts. They could become rigid or show decreased movement in certain limbs. Limping, pacing, rocking, or fidgeting are common behaviors that suggest pain. If a patient suddenly becomes less willing to move or shows a decreased range of motion, it might be a sign they are in pain. Behavioral changes are equally telling. Resistance to care, aggression, withdrawal, or social disengagement can all be signs of underlying discomfort. Mood shifts such as increased irritability, agitation, or signs of depression may also be linked to pain. Recognizing these emotional and behavioral cues helps paint a fuller picture of how the patient is feeling. Changes in activity and daily functioning are also important. Sleep disturbances, either trouble falling asleep or frequent waking, can be related to pain. A decrease in appetite, difficulty performing daily tasks, or increased falls might also point to ongoing discomfort. These are often indirect signs but are crucial for a comprehensive assessment. Physiological signs should not be overlooked. An increase in heart rate, changes in blood pressure, sweating, or pallor can occur during pain episodes. Breathing patterns might become irregular, especially if pain is severe. Monitoring vital signs regularly can provide additional clues about pain levels. To make this process more standardized, healthcare providers often use validated tools designed for nonverbal or cognitively impaired patients. The checklist of nonverbal pain indicators looks at behaviors like vocalizations, facial grimacing, guarding, rubbing, and restlessness, scoring them to estimate pain intensity. The Critical Care Pain Observation Tool evaluates facial expressions, body movements, muscle tension, and breathing, offering a detailed picture of pain especially in patients with severe physical limitations. Other scales like the Pain Behavior Checklist or the Chronic Pain Scale for nonverbal adults include assessments of emotional reactions, facial expressions, body language, and physiological signs, helping to track ongoing or recurrent pain. Applying these tools regularly and systematically is essential. Caregivers and healthcare professionals trained in recognizing subtle signs can better detect pain early. It's important to observe behaviors during different activities, especially movement or physical therapy, since pain often worsens with activity. Remember, some signs of pain can overlap with symptoms of muscular dystrophy itself or other health issues, so a thorough clinical evaluation is always necessary to rule out other causes. In the end, assessing pain in nonverbal muscular dystrophy patients is about paying close attention to their behaviors, facial expressions, sounds, and physiological responses. Using validated tools helps standardize this process, ensuring no signs are missed. This careful approach allows for timely pain management, which can significantly improve quality of life. Always consult healthcare professionals for personalized assessment and treatment plans, as each individual's experience with pain can be quite different. By understanding and recognizing these signs, caregivers can make a real difference in helping these patients feel more comfortable and cared for.